Hi, my name is Johann Hammer from Medical University of Vienna. I was asked by DDW administration to present my research entitled A Placebo-Controlled Trial of an Oral Capsaicin Load in Functional Dyspepsia Patients. This research was selected as a distinguished poster at DDW 2011. That means that the abstract was among the top 10% AGA Institute abstract selected for presentation. In the study, we evaluated the diagnostic value of a capsaicin test we have developed recently in patients with functional dyspepsia. Capsaicin is a pungent ingredient of chili pepper, and we were the first to show that the application of capsaicin into the stomach or the intestine induces pain, but also non-painful symptoms such as cramps, worms, or heartburn. In the present research, we evaluated the diagnostic value of an oral capsaicin load in patients with upper gastrointestinal symptoms, but without alarm symptoms. We identified 116 outpatients, and among them, 73 patients met the criteria for a final diagnosis of functional dyspepsia. All patients swallowed a capsule containing either capsaicin or placebo at 2 different days after an overnight fast. They also filled out a previously validated graded symptom questionnaire. Based on our previously published data, a final score of above 9 was considered a positive test. Our main results are as follows. The functional dyspepsia patient had significantly higher perception scores after ingestion of capsaicin capsules as compared to other patients with upper GI symptoms but without a final diagnosis of functional dyspepsia. On the other hand, after placebo, symptom scores were low and not significantly different among patient groups. 45% of functional dyspepsia patients had a positive test after capsaicin ingestion, while only 11% of control patients were positive after capsaicin. And finally, clinical characteristics, age, and gender distribution did not differ in patients with functional dyspepsia who tested positive or negative after the capsaicin test, and the sensitivity to capsaicin was unrelated to clinical symptoms or Rhone subgroups of functional dyspepsia. It also has to be mentioned that the value of patient blinding was excellent. I summarize that more than half of patients with functional dyspepsia were hypersensitive to capsaicin, and placebo response was negligible in this patient group. Compared to functional dyspepsia, sensitivity to capsaicin was much lower in patients who had upper GI symptoms with no alarm symptoms, but who did not meet the criteria of functional dyspepsia. I conclude that the capsaicin test is a simple, non-invasive, and relatively inexpensive test useful for stratification of patients for further clinical studies. Thank you.